So today we're having our very own Ariana and Dan to present on her pilot study this summer in Buenos Aires, Argentina, on the egg donation landscape there, and also talking about some of the perspectives of the medical professionals on egg donation and ART. So take it away.
Awesome. Hey guys. Thanks so much for coming. So very much influenced by Dr. Tober's lovely titles. She always comes up with the best ones. So it takes a team to tango. So like Bambi said, this is mostly looking at the pilot study I did this summer in Buenos Aires. I was there from the end of May to August. Really speaking mostly with medical professionals. So I'll talk a little bit more about my methods later, but just some key terms that I think are useful to see, because I'll usually use these acronyms moving forward, and there's a lot of them. So ART, talking about assisted reproductive technologies. Also very grateful Dr. Tober went first a couple weeks ago, so hopefully some of this is familiar to some of you. But with ART, in this context, we're talking about specifically medical technologies used during egg donation and conceiving with an egg donor through either IVF, so in vitro fertilization, or ICSI, intracytoplasmic sperm injection. I have some lovely images later to distinguish the two. Another term I wanted to bring up here, which I think is important in the context of ART, is collaborative reproduction. So talking about ART as a collaborative effort, it's a team effort, especially with the use of a donor gamete. And then also, I'll touch a little bit on egg freezing. You may hear egg freezing or other terms like vitrification or cryopreservation. These are all fairly interchangeable. Vitrification is the newer technology that is very important in the context of egg freezing, in that now we know that we can freeze eggs almost like glass, which is really amazing, and there are better long-term outcomes when thawing those eggs and using later on. But this is all under the umbrella of freezing or cryopreservation. So a little background on kind of a little bit of my interlocutor groups and why somebody is seeking ART. So for this project, I'm really looking relatively threefold at medical professionals, egg donors, and intended parents, and those who are using recipients of a donor egg. And in the context of ART, we're looking mostly at infertility being a reason to utilize a donor egg. So infertility affects roughly 15% of kids worldwide. And when we say infertility, this is usually characterized by a year of trying to conceive with no success. And in Latin American countries, we're specifically interested in those cultural pressures, societal influences, religious influences, and the structure of the healthcare system, which I'll go into in Argentina, which is pretty interesting. That can really impact those feelings of shame and frustration, which would push somebody to seek ART. And we have seen an actual increase in use of ART in Latin American countries. There's been an annual 3% increase, and also an increase in use of donor eggs. We see use of the donor egg when fertility may be compromised due to low ovarian reserves or other age-related factors. So this is an image, slightly dark, but of one of the labs I visited this summer. And here's where IVF and or ICSI would be performed. So just to kind of distinguish these two a little bit. So classic IVF, what we consider here is when, in this context, a donor egg is introduced to sperm. It's left there to fertilize for a few days, and then that embryo is transferred back into the intended parent. ICSI, on the other hand, similar, but a singular sperm is directly injected into the egg. So the success rates of this, when no male factor infertility is present, is pretty 50-50. There's not really a benefit to one over the other, but when male factor infertility is a known situation, ICSI is preferred to ensure that fertilization occurs. So the process of egg donation is very complex. As Dr. Tober obviously showed in her documentary, it's a very long, grueling process, and really takes several months. If that process goes successfully and the donor does pass what will be genetic testing, psychological evaluation, and other overall physical health checks, then they may be matched with a recipient to go through with becoming an egg donor. So egg donation is usually done, and in the clinics I visited, it's all done fresh, meaning that the egg is directly transferred, fertilized, and then transferred to the intended parent. So in order to do that, the recipient and the donor must sync up. So this will usually start with birth control to sync up cycles, and then the donor will go through medication injections with Lupron to help stimulate follicle production, and then other hormones like the human chorionic gonadotrophin, HCG, which will mature those follicles, and then they are ready to be retrieved. And as we've seen also from Dr. Tober's work, is that the degree to which or the amount of medication given can also impact the number of eggs able to be retrieved from a donor. It's also very dependent on how the donor responds to that medication. So we know that there are a lot of risks involved as well. So some of these risks involved are ovarian hyperstimulation syndrome. We also have cases of ovarian torsion and onset of other menstrual disorders such as PCOS or endo, which can come about. So once egg retrieval has occurred, then IVF or ICSI is performed, and the embryo is then transferred into the intended parent. And that's egg donation, folks. And so what makes this context a little bit different with Argentina is here in the States, for example, the process of egg donation, a donor is not necessarily anonymous. They're it's kind of like looking through a catalog a little bit. Your ability to know what you're looking for in a donor and pick out some of those phenotypic traits that you're interested in. In Argentina, similar to countries like Spain, this process is anonymous. So what happens is many clinics will choose to use either programs, this is an example of a program used by a clinic, either phenotypic matching programs, or they kind of have this old school method of going through with tables and charts to match phenotypic traits between the intended parents and the donors. So in many of the informed consent I was able to see that donors go through, it often says you will not have the ability to choose the phenotypic traits of your donor. You must consent to your provider making that decision for you based on your phenotypic traits. What makes this interesting too is the context of the Europeanness in Argentina. So what most of my participants noted and what literature shows too is that the demographics of Argentina are roughly 97% identify as European, being from Spain or Italy descendant. So this aspect also changes a little bit of who they're looking for in an egg donor. More likely, those can match those similar traits, which can be a little bit dicey when donors from other areas would like to come in and donate. And I bring this up mostly because egg donation is still a market in countries like Argentina, in the context that there is compensation for egg donation. It's not to the same degree that we see in the United States, but it is still enough to be a major contributing factor to motivations for egg donors to go through this process. So within Argentina, it's also a very interesting landscape to explore because in 2013, they passed a law that subsidizes medically assisted reproduction for all Argentine citizens. And this is inclusive of age, sex, marital status, which was a pretty big deal. And the idea here is that it would help to increase the declining birth rates in Argentina. And we have seen a use of ART increasing, like I said, annually 3% in Latin America. There's also been a 20% annual increase in egg freezing. Although egg freezing is not necessarily covered, it is an interesting social factor to look at with postponing motherhood. And this is also pretty important in the context of what Argentina is currently going through economically speaking. So as of today, Argentina is sitting at about 125% their inflation rate. When I arrived in Argentina, it was about 114%. So $1 US was equivalent to about 450 Argentine pesos. Today, it's about 1 to 1,000. So this is really really challenging, but it is really influencing a lot of the insurance and the healthcare system as well. So for this pilot study, I was able to conduct open-ended semi-structured interviews with fertility care professionals, and this included psychologists, embryologists, OBGYNs, reproductive endocrinologists, a lawyer in healthcare, which was also really interesting. And also, I did speak with one recipient. She had gone through 13 years of fertility care. She's actually now working as a fertility professional herself, but still very much identified as a recipient. I was also able to visit 3 fertility clinics and participated in empirical observation. This was mostly in OR settings, so I was able to actually see a few retrievals, which was pretty cool. And these interviews were primarily conducted in Spanish, and I was really trying to explore the role of the professional in this setting. So what are medical professionals' perceptions around the current legislation around ART and how the process of egg donation looks, especially with the current socioeconomic climate that's happening. So some of the findings for this, the first notable one that I was really interested in is how many eggs are being retrieved here. We know that these numbers can really vary, and sometimes self-reporting data from donors can also look a little bit different than what medical professionals are also putting out. Here in Argentina, about 10 to 15 was the ideal number of eggs they're looking to retrieve during a cycle. And the idea is that they were all seeing that the clinicians are not looking to overstimulate. They're usually looking to overstimulate and have their patients, of course. But it did seem as though this matched up more or less. When I was in the OR, I believe the retrievals I saw were all actually under 10 retrievals, which was pretty impressive for that. What was also interesting is that embryologists showed lower numbers dependent upon obviously how the egg donor is responding to medications, but several of them noted that this could also be due to stress levels. So something we're interested in exploring a little bit more too is how cortisol is affecting the uptake of glucagon and HCG in producing follicles. And a lot of them links this to increasing inflation rates. So currently 42% of Argentines are living below the poverty line. And when you go to any store, when you go to the grocery store, it will say, would you like to pay for your groceries in increments of 15? It's a huge stress, and homelessness, precarious housing has really increased as well. So all of these stresses are definitely impacting reproduction as well. They also follow pretty global guidelines when it comes to number of cycles that are appropriate, the recommended maximum number, which is 6. But this, of course, comes with a caveat. And that is that all the medical professionals commented on the severity with the lack of donor registry. So because there is no standardized donor registry within Argentina, there's no way to track how many cycles a donor has completed at all other clinics. So what that means is that a donor can go to one clinic for, say, up to the recommended maximum 6, and then go to another clinic and do it over again. There's no way to really prevent that from happening, and it happens quite often. And what we know with the risks involved with egg donation is that there is a potential for increased risks with beyond 6 donor cycles, especially if instances of ovarian hyperstimulation have been found in earlier cycles. It could be a predictor of subsequent OHSS later on. This is also an issue when it comes to compensation. So I'll talk a little bit about motivation that was involved and why some providers kind of thought donors still go through with this process. But the range in compensation is creating pretty big competition between clinics as well. So often donors will go to a clinic and they might leverage what another clinic offered them in order to get more from a clinic that they want to donate with. So the compensation, like I said, although it's not as high as we see here, sometimes I'm sure some of you have gotten ads. Pretty sure in Courtney's, because she's like, I'm going to start getting egg donor ads now. I'm talking about it all the time. But it's the compensation levels here are pretty high. You'll get these ads, it's like $80,000 to donate your eggs, which sounds amazing. Now you're not really getting 80,000 coming out of different places, but in a country such as Argentina, it's usually the minimum monthly salary, which is about $300 US. But again, context, when inflation is about 125%, $300 seems really good. So a little more to that, and I'll talk about inflation a little bit, but what makes this interesting too with inflation is there's within Argentina both a blue dollar market and then the central national bank. So the blue market is a euphemism for the black market, basically, and this is how most Argentines are converting their money. So what you'll do is you will bring cash to one of these parallel markets, and they will provide you almost double what the central national bank is offering you. And this has come from distrust within the Argentine government and the central national bank. With inflation rates skyrocketing, people want to get out of the bank. So they would rather have their money in dollars and transfer it in the black market as opposed to keeping things in banks right now. So that, in addition to the rising poverty levels, we do see an increase in people also wanting to donate eggs. And we see this inflation is super apparent. So this study did take place in Buenos Aires, but I want to make it clear too that Buenos Aires is a very, very large province. It's not just a singular city. The city within Buenos Aires, Capital Federal, is pretty posh. They like to call it kind of the Paris of Latin America, which it totally is, but cooler, I think. But other parts of the province have been hit by inflation very severely. So one such area was La Plata, which was an area I visited to go to a clinic. And the effects of inflation were obvious. And we do see this in areas within the Capital Federal in Buenos Aires as well, but truly outside of that city, this is what's happening in a lot of Argentina. And you wouldn't really know that this is where a fertility clinic is, but it is. So it was a little, had I not seen the emblem on the door, I probably would have missed it. I'm pretty sure I walked down the street about 3 times before I finally made it in. But the reality is too, you have a lot of people who are coming from areas that are really suffering with inflation, who are coming to donate eggs because it's an opportunity for money as well. So when I talked to medical professionals a little bit more about this and why they thought not only what the motivation for donating eggs was, but also potential benefits. I was curious to know, what do you think the real benefit of donating eggs would be? And these were the 3 responses I had most often. One that struck me as very interesting that I hadn't really thought of before was medical history. So this was a great point in which one professional said it's a great opportunity for young people to come in and learn about their medical history that they otherwise would not have access to. And not only that, but they can now provide this to their family members who also might not have access to those medical records. So if they've now just done all this really intensive genetic testing, they can provide that to their family, and that's a big deal. Especially when the healthcare system is set up in a way where they might not have received a pap smear at age 25 yet. They might not know anything about the BRCA gene and things like that. They really influential in their life. Obviously, another one was compensation. And what I thought was interesting too with many professionals is that there seems to be a divide. So within Argentina, the age range to donate is between 18 and 32 years old. So a couple professionals told me that between 18 and kind of about mid-20s, the motivation is usually altruism. They believe that these younger university students are more inclined to want to give back. They're young, they think, I have all the time in the world, I don't want to have kids yet, I would like to do something for somebody else. And Argentines really pride themselves in having this very altruistic nature about them. But then she said that the other half, which are so late 20s, early 30s, some who may already have children before, that motivation can be mostly rooted in compensation and really with struggling with inflation, and it becomes a very survival day-to-day thing. I will do as many cycles of this as I have to support myself and my family. So in addition to kind of donor motivations, I was also interested in intended parents' motivations. So kind of what the societal feelings around infertility are within Argentina. And I spoke with a lot of fertility psychologists who were able to talk about this kind of resounding question that most of their patients say, which is what's wrong with me? And the idea that infertility is equated with being broken. And often there's a lot of anguish, humiliation, depression around infertility. And within Argentina specifically, although about 92% of Argentines identify as Roman Catholic, they may not really be practicing, but it does become a very social influence. And that spirituality really comes through. A lot of the psychologists noted that although it's not necessarily a very religious hand in it, many people will say that the pressures of you might not be manifesting it enough. You must not have wanted it enough. You haven't put it out into the universe enough that you want to have children. And especially when female factor infertility is included in that, there's a lot of genetic grief associated with using a donor egg. So women who do eventually go through with ART with use of a donor egg really feel as though there's reproductive loss there. But it was also an interesting caveat of them wanting to go through with it, but unsure if it was really their own want. And so one psychologist noted, the pressure of why don't you want to be a mother is there. That's the question. Do I want to be a mother for myself or because of the pressure of others? It's very hard. So these societal pressures that are there are often there at a very young age. I spoke with one recipient who, like I said, had gone through 13 years of fertility care. She finally conceived at age 46, had a healthy child. The first 5 IVF cycles she went through with her own egg, and then finally she had to start using a donor egg. Did 5 subsequent cycles with a donor egg. But I asked her, like, did you always know you wanted to be a mother? Yes. That is something from day one. I knew when I was a small child, I was going to be a mother. I'm also a doctor. I'm also this, I'm also that. I'm not just a mother, but that is very much ingrained in who we are as Argentinians, was very much the sentiment. So to make that possible, a little bit more on the insurance and the law, I asked about how the current legislation around there is really supporting ART. Is it making a big difference? And professionals were actually not too keen on it. There was a lot of issues with regulation of this law. So some great things about it is that it does cover up to 3 treatments annually if it's a more complex form of ART, so when use of a donor gamete is involved. Caveat being that medication's usually not covered by this though. And there were some other interesting things that came from this. Many foreigners are contributing to medical reproductive tourism, so some clinics are increasing their prices a little bit because they have folks coming in. Within Latin America, a lot of people from Uruguay coming in, a lot of people from Peru coming in, or Chile. Also, a lot of people from the United States that are coming in. A really large group of Americans are coming in and utilizing the medical reproductive services here because costs are so low with current inflation rates, and quality of care is really, really great there. This law will cover use of so ART with use of your own eggs until age 44, and with use of donor eggs until age 51. That was the only age kind of limitation within this. But there is lack of regulation with this law. And one lawyer I spoke with who works in the health department noted often that's the very painful part of the law, that it's not inclusive at all. If you have Obra Social, so Obra Social is the public insurance that works there. There's 3 levels of insurance that would cover treatments like this. The Obras Sociales, Prepagas, and then Privadas, so your private insurances. Let's think about a woman that cleans an apartment for an entire family for work, but she can't have children herself. Her Obra Social has this tiny clinic where she can have the fertility treatment. She will go to that place for the treatment. They need to have 30,000 pesos for the medication. That doesn't seem inclusive at all. If you think about the people with low resources or with low salaries going to a fertility clinic, they won't encounter this problem. And not only that, so now you're faced with these medication charges that you have to pay. What his job is people will come to him and say, I don't want to pay for this medication, there is a resolution that says I could protest that the clinic or my obra social cover this medication. Well, now you're paying 30,000 pesos to my lovely participant here, who's going to now sue the obra social and sue the clinic for you. So what he says is either way, you're basically shut out of luck. You're paying this 30,000 pesos one way or another. And that price has actually gone up since August. We're probably looking more at 50 to 70,000 pesos because of inflation rates. And with current political situations happening right now, it's looking like that's going to keep increasing, unfortunately. So one last thing I touched on here was asking about egg freezing. It is something that's very, very, very up and coming. And while I was there, it was all over the news, in the media, and all of the clinics were really talking about it because there has been a 20% annual increase in Argentina of egg freezing, which is really fascinating given how the societal pressures for motherhood are so there at a young age, yet women are socially postponing motherhood. So, that being said, what's interesting with egg freezing and what I'm hoping to look into a little bit more in the future is what's happening with all of these eggs now. Every time I asked embryologists, great, so what percentage of women are coming back to use their eggs? Every single time they laughed at me. I think that was the response I got from every single clinic I visited. We never really see full return. And then they say, realistically, maybe around 10% will come back for their eggs, but now with vitrification, they can keep these eggs for as long as they need. But that cost is not covered by insurance companies. Egg freezing is only covered when a pre-existing condition is there. So if somebody is going through cancer treatment and they know that the quality of their eggs is going to be decline, then they can freeze their eggs. Or if there's other conditions that do affect quality of eggs, but otherwise that's more of a social reason, and they will let us out of pocket. That being said, it's also fairly affordable in Argentina. But with what to do with these eggs, I also asked clinics, do you ever use them in the donation cycle? Here in the States, there's a process that's coming forward that's a freeze and share, right? So in order to offset costs of freezing your eggs, you can opt to share half of the eggs that they retrieve. And some clinics do offer that here. But what will happen is that there is also a lengthy informed consent with that because the people who froze their eggs did not go through the same screening process as an egg donor would have. So it is an option, but not many people really want to use the donor who hasn't gone through months of genetic testing. So oftentimes they will just be discarded. So some next steps with this research, we're hoping to start doing some egg donor surveys. So similar to Dr. Tover's work, expanding on that, looking at donor self-reporting data, and from there also interviewing with donors and intended parents and recipients. Hopefully going back, doing some more clinic visits. And I'm interested in following up a little bit on egg freezing and seeing what that landscape looks like in Argentina. Thank you.
This is outside the scope of what I really interested in. But so my mind kind of goes to provider incentivization and some laws about insurance coverage.
Yeah.
Do you have any and also the under harvesting relative to the over harvesting that Trevor's research has kind of found?
Yeah.
What's your sense of unintended incentivization for providers?
A great question. I would actually say that providers were really actually unhappy with the law in the sense that they felt that they had to treat more people than they would like to. Was a sentiment I found. So patients that under circumstances prior to the law, they probably would not have undergone ART with. So women of a more advanced age where there's potentially more maternal risks involved, or those who may not be in super tip-top shape for fertility treatment. But with this law, they are required to provide those services. So it doesn't actually feel like much of an incentive, really, But they've noticed that it's actually, been an issue for their clinics because pregnancy outcomes have declined, or the success rates have declined overall, and it makes their clinics actually look not as great as they used to. They used to have these really nice shiny numbers when they could select who they were treating, and now it's because there's more universal coverage, those outcomes don't look the same.
This is the pricing clinic to clinic.
Pretty even, I would say. I had one clinic where they were saying they would compensate participants about 100,000 pesos for the process. Others closer to 50,000. But they really do compete with each other.
But the services.
For the services, oh yeah, the services are pretty across the board. Yeah, that's pretty across the board. So like egg freezing, for example, is about like $300-ish. Yeah,
That's pretty even to the recipient cost to the donor.
pretty even. But it depends too. I mean, if medication's not covered, right, then that's going to be an added expense that's really going to get. Yeah.
Have they seen much in the way of women traveling, like say from the United States to Argentina just for the egg freezing? Because here it's like 10 to 20,000.
Yes, I asked about that, and they said absolutely. Like there are definitely people who are doing that. The issue is though that they're coming and they're never coming back for their eggs.
In Spain.
Right, but it is happening. I mean, they even ask you, they're like, oh, well, it's great here, and it's great quality, and it's pretty cheap. You want to do it while you're here? And I'm like, whoa.
Yeah.
Not the participant observation I'm looking for this time, but appreciate the offer. But yeah, it's very much happening. We see that not just with egg freezing, but also with overall services. I mean, even if you're paying out of pocket for ART services, I would say it's closer to around 3,000, 4,000 for a cycle. Yeah.
Compared to like 15 here.
Compared to about 15, yeah, 15,000. So it's a big difference.
Out of curiosity, you mentioned like they cycle with Lupron first in Argentina. Have you? And that's kind of like an old protocol for here. Most clinics here don't start off with Lupron. How long were they injecting the Lupron at the beginning of the cycle?
So there was one clinic that actually gave me a wonderful little infographic. It had too much of the clinic information on it. I was weary to post it. I think some clinics do it a little differently, but it was about I know about 10 to 14 days of injecting medications. So not just Lupron. I think it was about 3 to 4 days of Lupron, which sounds about right to me, and then HCG more traditional. Yes, very much so. So the current political climate in Argentina, they're going through presidential elections right now. So that's actually happening this month. And the current front runner is a really wild card libertarian, Javier Milei, and he, yeah. So his platform is that he wants to cancel the Central National Bank. That's his first thing, is to completely liquidate it, and then to cancel the Department of Public Health, Department of Education, Department of Transportation. If something goes in this, maybe he can help me out too. But there's a few. His goal is to completely dissolve these. So yeah, it's going to be a huge issue when it comes to social health care. So the Organización that currently covers the majority of Argentines, it will be like the rug is under them. And it doesn't really sound like he has a plan for that. He just says no more public health. So that's cool. But the issue is that he did win the primary because he is leading still. Yeah, there was debate last week and he is still leading. The issue is that Argentina has been under a rule of kirchnerism and Peronism for decades. And with current inflation rates, they're just really dying for anything that's different and not Kirchner and not federalism. So he is the only wild card right now, and that is really appealing to a lot of people. Yeah, exactly. I mean, it's very much like a Bolsonaro situation too. So it's an issue, but economists are saying that, I mean, with what it's looking like, inflation rates will quickly reach Venezuela levels. So Venezuela is at around 800% inflation for reference. And Argentina are kind of anticipating that. So the dollar equating 1,000 pesos now, it's anticipated to go up to 8,000 by the end of this election cycle.
Insurance, I'm sorry.
No, go for it.
Like, how do insurance respond to that? They have to pay out because the law requires it. I mean, are they trying to deny people services?
Yes, so there's a lot of issues with the amount that a service will be covered. So my one of my participants who works in healthcare as a lawyer talks a lot about the amount that a condition will be covered. So there's a lot of there's no real standardization with this, but what they will say is something like a chronic illness, we will cover up to say 70% of those medications. So if you have diabetes, 70% of those medications, the cost of that medication will be covered because they know it's a illness. If we're talking about the type 1 diabetes. Infertility, though, they treat as a very temporary situation, something that can be fixed with ART. And so those medications are not considered necessary for life. And so insurance companies will simply say that that doesn't need to happen. They don't need that in order to go through with this treatment, and they don't need it to overcome the covered, which completely contradicts the whole idea of medications in the first place. So it's a lot of the language around it is not standardized. There's a lot of issues between that and communication with clinics. It's also dependent on what insurance companies clinics choose to use. So in the clinic I visited in La Plata, that one saw a lot of people who were working on obras sociales, and they were using public health insurance. They did cover pretty wide range of public health insurances, but some of the other clinics I visited in the city center, private insurance is going to be preferable. And the issue there too is that although you will have that coverage, so if you have an obra social and you're covered to receive ART, that might be okay. You just won't be able to go to a really specialized place. You may go to a general reproductive endocrinology department in a hospital, but it won't be a specialty fertility. Right, so it's also going to impact your quality of care and health. Yeah, sure.
That was in the beginning of your presentation when we talked about the fertility affecting 15% of the couples worldwide. We know what the percentages for people in this area.
I've tried to look at fertility numbers, but I have not found. I will say that it has that same study with Marcia Inhorn has talked about the disproportionate statistic of Latin America. So disproportionately affecting, so like socially speaking, Latin Americans in that worldwide infertility, 14% of couples that face infertility will usually end in separation. But that number goes up to about 21% in Latin American countries.
I was quite that would tie into the insurance question. How much are insurance companies actually in? How much are probably 1% of the population?
Right.
Then that's not a whole lot of expenditure. But if it's 80% of that population, then that's a lot of expense.
Absolutely, it's a great point. And I know now that there's a lot of literature coming out that's talking about infertility as a public health concern and a public health issue. So I think the biggest thing is the birth declines. Argentina has been in a pretty steady fertility decline. With about like a 1.2% decrease usually annually. So that was definitely reason for the law to go through. Or at least impacted influence it for sure. But yeah, I think that's a great point. Absolutely.
One is, are the professionals in Argentina supportive of the idea of having a registry? They were very supportive in Spain, but they're absolutely not supportive of United States.
Which makes sense.
Right.
It totally makes sense. And I think that the Argentine system is far more similar to what you find in Spain. They're very much in favor of it. They desperately want to register. They're very concerned with risks of OHSX and other things, and they know realistically that their clients are going to other clinics. They know that, and it's a big thing. Definitely.
And then the other question would be, what's the policy regarding providing services for single people and same-sex couples?
Yeah, so I didn't get too much info on that. I will say there's so surrogacy is really big in Argentina as well. That there's been something recently since the conflict in Ukraine, where a lot of Ukrainian women are coming to Argentina, not as surrogates, but who are already pregnant to receive reproductive health care because it is so good there. And Argentina has always been a very easy and accessible place when it comes to visa services. So very short waiting periods, it's a pretty decent passport to have. You're part of Mercosur, which is this pretty awesome, expansive area throughout Latin America. And what started happening was a lot of Ukrainian women were coming to the gates in Argentina, and they were being turned away because they knew that these women were coming here specifically for medical tourism. And it is a really severe burden on the healthcare system there as well. But yeah, I would say I know surrogacy is a big thing there as well. There's a lot of surrogacy. There's also the Ropa method. I don't know if that's in Spain as well. So there's the Ropa method, which is for same-sex female couples. And that method is basically where the egg from one female partner is taken and fertilized, and then the embryo is implanted into the other partner. So the idea is that there's, again, it's not collaborative reproduction there. Yeah, I mean, obviously sperm donation is still pretty big there, and some other families.
Yes, surrogacy is completely banned in Spain. So I think Spain,
Right.
a number of from Spain, like in Argentina.
Absolutely. Yeah, absolutely. Yeah, I know it's banned in most of Western Europe too. Yeah. Yeah. Yeah.
How do you like know that you know the in our school like especially like American women coming over they have some of these procedures that like they feel positive about it, like the fact that it's still in, like you get hated because like some women like that's like.
So you mean like local population as opposed to medical professionals?
Yeah.
I don't really know. I wasn't, yeah, I mean, I would say it's probably not a massive concern for them directly. I would say more often than not, they probably don't know the huge numbers of reproductive tourism coming in, realistically speaking. Medical professionals, though, it's a big deal. It's both a benefit, and there are clinics that are actually striving to be reproductive tourist hotspots. There's one clinic I was working with that was their thing. Like their webpage was totally in English. They tried to be super accessible. Email us for accommodation, email us for the best tango shows in town. Like it became an experience, truly. Like you're here for 7 days, like here's our top restaurants, like go to Don Julia. They really make a whole thing of it. Because they know that they're getting that money directly, right? They can have higher costs, the quality of care is really good, and they are getting all that. At the same time, that's often at the risk of kind of hyperfixating on your incoming clients from your expats as opposed to the local population, which is also speaking to that inclusivity aspect of, is there really inclusivity with this law? And the general consensus was not really. Yeah.
So I know you mentioned the European but in Latin America, do like Europeans have comfort do the same thing, but they're expensive or money?
It's a great question. I'm also not entirely sure. I mean, I can only speak to like Spaniards or Italians I've met living in Europe who would say probably not. I would say though, what's really common in Argentina is, so it's a very common practice that if you have any ancestry, Spanish or Italian, you just need to go to your consulate and you can receive a passport. You don't have to have ever gone to Spain or Italy. It doesn't even have to be one of your parents. So most young people in Argentina have a Spanish or Italian passport, and we're seeing right now that most of them are leaving and they are now going to Europe because it's impossible to survive in Argentina. I mean, with salaries so low, and I mean, literally every single store you go into is how many quotes would you like to pay this in? And the idea of paying off, if my groceries for a couple weeks would be 15,000 pesos, and they're asking, would you like to pay this off in 5 or 6 increments? And by the time you're done paying that off, you've already made 3 or 4 more stops at the grocery store. I mean, I would have to shop around at like multiple different places. I think I had a taco diet at one point, and I was like, I had just spent $15 on one thing of Greek yogurt, and I'm mortified by that. Like this big, and I'm like, oh my god. Did not realize that, you know, but, and it seems a very silly thing to comment on, but when that's the reality of every product coming in, you know, completely, yeah. I still got the Greek yogurt though. What?
You look at really fast because of that last name.
I did. Well, I think it's also because
Also, why is Roma abandoned, like what in Europe and Spain? What is that? First of all, language and this is the whole for the thing. So I think that's.
Oh, yeah.
Why is that banned?
why is that one?
Banned or like the started in Western Europe?
Oh, that's surrogacy.
Oh,
Surrogacy. So surrogacy in most Western European countries is banned as well. So it's just a lot of standardization and legal issues. It's, you know, a huge issue. And also even in hotspots where it was really popular, like India, it's now been banned. So it's becoming definitely dwindling for sure. I mean, which definitely makes sense in, you know, conditions in many of these places, right? But no, it's still practiced in Argentina. A bit of research actually going on there right now, which is cool. Surrogacy is very hot topic there. So, yeah. Thank you. Thank you.